And looks like I got that confirmation that that's going. Okay. Well, welcome everyone to the June meeting of the Environmental Quality Board, or EQB. I'm Nancy Daubenberger, Commissioner of the Minnesota Department of Transportation, and very honored to serve as Chair of EQB. And very sorry to not be with you in person today. I was out on a medical leave last week and I still have some mobility restrictions. And I understand there are a lot of board members there in the room. So really bummed to not be there today, but of course, glad to be with you virtually. I'm especially pleased today to welcome 4 new public members to the board. They are Joseph Barton, the new public member from Congressional District 2, Rebecca Hogg, from the new public member from CD6, Brian Dingman, new public member from CD7, and Emily Larson, the new public member from CD8. And also happy that Peter Bakken will be serving another term as the public member from CD1. I'm glad to have you today. Looking forward to having you all bring your diverse perspectives and experiences to our board discussions. So welcome new board members. All right. So with our transition of public board members, we also need to fill out the roster for our Environmental Review Implementation Subcommittee, or ERIS, as we call it, based on their experience in permitting and review. I'm appointing Rebecca Hogg and Joe Barton to ERIS, effective for the ERIS meeting that will be next month. So welcome and thank you for stepping up into that ERIS role as well, Rebecca and Joe. All right, so I think that's it for me, or from me for now. So I will go ahead and turn it back to Executive Director Nuschler to please call the roll.
Thank you, Chair Daubenberger. I'm going to call the roll just so folks know when we have anyone participating online, we do have to do votes by roll call. So you'll hear your names and then you will hear your names again shortly. So be prepared. Commissioner Arnold or Assistant Commissioner Lee.
Could we figure out who's?
I think we got it. Yep. Board Member Bakken, I don't believe could make it today. Board Member Barton. Commissioner Cunningham could not join us. We have Assistant Commissioner Kunis. Welcome. Chair Daubenberger.
Here.
Yeah. Board Member Dingman. Yeah. Commissioner Gronball. Here. Board Member Haug.
Here.
Chair Holman.
I'm here.
Board Member Katzenberger.
Here.
Commissioner Kessler could not join us. Deputy Commissioner Tester, are you with us?
Yes, I'm here.
Here. Board Member Larson. I believe Board Member Larson might be a couple minutes late, but she is planning on joining us. Board Member Martin.
Here.
Don't believe Commissioner Verilek could join us. Do we have Deputy Commissioner McKinnon?
I am here. Kevin, thank you.
Commissioner Peterson?
I'm here.
Board Member Smith? Commissioner Stroman? I'm here. Do we have Councilmember Lindstrom? Oh, you are here.
Good afternoon, everybody. Hello.
Oh, thought you guys were on the road. Wasn't sure we'd see you. All right, did I miss anybody? All right, Chair, that's 11 members here and quorum is 9.
Great. Okay, so with that, we can move on to the next agenda item, which is approving of the consent agenda. So members, that refers to meeting minutes from the April 15th, 2026 EQB meeting. And the preliminary agenda for this meeting today, June 17th of 2026, that's on packet page 3, excuse me, your packet. So with that, is there a motion to approve the consent agenda?
Move approval of the consent agenda. Yeah, the consent agenda.
Heard approval and a second. And Director Nuschler, do you have down who those were?
I do.
Okay,
Peterson
perfect.
and Board Member Smith.
Thank you. All right. Is there any discussion on the motion? Hearing none. Executive Director Nuschler, please call the roll on the motion.
Commissioner Arnold, not with us. Board Member Bakken is not with us. Board Member Barton.
Customary to abstain if I was not present.
You can.
I'll abstain.
Okay. Commissioner Cunningham is not with us. Chair Daubenberger.
Yes.
Board Member Dingley.
Okay, so I think I'm okay with her.
Commissioner Grunwald.
Yes.
Board Member Howe.
Abstain.
Chair Holman.
Yes.
Board Member Katzenberger.
Yes.
Commissioner Kessler is not with us. Board Member Larson, she joined us. Here. Board Member Martin.
Yes.
Commissioner Barilak is not with us. Commissioner Peterson.
Yes.
Board Member Smith.
Aye.
Commissioner Stroman. All right, Madam Chair, we have 8 on that, and we do have to have 9 to pass the agenda, and I should have thought of that. I apologize to those of you that were not here. We could vote on the agenda separately. Apologize for my poor parliamentary procedure, unless someone would be willing to.
Did watch.
Oh, okay.
Yes, I will. I will go change that to a yes.
Thank you. Thank you.
You moved us along already.
All right, appreciate it. That's 9, Madam Chair.
Awesome. Great. Well, then the motion carries and the minutes and agenda are adopted. So I will once again turn it back to Executive Director Nuschler for the ED report. Go ahead, Catherine.
Thank you everyone for joining us today. Thank you for rolling with the parliamentary fund here at the beginning. And thanks to those of you in person who made it through the construction project outside. I'm really glad to see you and just would echo the chair's welcome of new members. So logistics, the meeting is being recorded. As you'll notice the notifications, one of which just thought I was speaking in Hebrew, so I'm not really sure what's going on with the recording today, but hopefully that will not impact our minutes. For those of you online, the meeting chat is open and visible, but we do not keep that as part of the meeting record, so please just use it for logistical issues if you can't hear or something like that. Board members, we're going to have a couple of presentations today, and of course the presenters welcome your questions and feedback. Feel free to raise your hand or jump in during discussions. You can use the raise hand function if you're online. Board members, you should be able to mute and unmute yourself. And if you can put your camera on while speaking, that's helpful if you are online. If members of the public are joining us, you will have an opportunity to comment at the end of the meeting. Again, when we get to the public comment part of the agenda, please use the raise hand button and we'll add your name to the list of commenters. I don't believe we have any members of the public with us here in the room. And then we'll queue commenters at that point in the agenda and let you know when you can speak. There is sometimes a slight lag with the unmute function, so just be prepared. And there's more information in our packet if you need help. All right, so moving on to the director's report. A couple of notes logistically for public members. This is the last meeting of the state's fiscal year. The fiscal year closes on the 30th. So if you have per diem forms or expense forms to send to us, please get those in a timely manner, please. Logistics there. Generally, I want to put a little note in about data centers, which have been a topic that we've discussed at some of our meetings. So since our last meeting, there have been a couple of rulings on some of the lawsuits related to environmental review conducted for potential data centers. In Pine Island, a temporary order was issued prohibiting construction, likely until the challenge to the AUAR review is resolved. And in Faribault, which completed an EAW for the data center, the Court of Appeals ruled that the city's declaration that an EIS was not needed was unsupported by substantial evidence. And so the court reversed the decision and remanded it back to the city. So we are watching those lawsuits just primarily to identify if additional or revised guidance or advice from us to RGUs and project proposers on environmental review might be needed based on those court decisions. So far, we haven't seen something, we haven't seen anything that I think would cause us to change our general advice so far. Usually at this point, I would give you some updates on some of our work, but given that the next agenda item includes some fiscal 26 wrap up and discussion of the work we've completed, I'm just going to leave my information for that agenda item. And I see Board Member Larson has joined us. So welcome, Board Member Larson. That's all I have, Madam Chair. And you're on mute.
Thank you for that. Thanks for the report, Director Nuschler, and I echo the welcome to our new board member, Emily Larson, who I understand just jumped on. And with that, are there any questions from board members about the Executive Director's report? I am not seeing any hands raised or anyone raising hands there in the room online. Let me know if I'm missing anything, Catherine.
I think we're good here.
All right, thank you. Okay, so let's go ahead and then move on in the agenda to item number 4, and that is our EQB overview and updates. And so that is also presented by Executive Director Nuschler. So go ahead and take it away, Catherine, again.
Thank you. Priscilla, you're gonna load up my slides for me. Thank you. So I thought with the new members here, I'm kind of doing a combination of sort of a history of brief history of EQB, a little bit of information about our budget, and then also for those of you who've been around a longer, kind of a wrap up of the work we've been doing in fiscal 26 as we start to think about work planning for fiscal 27, which you'll hear more about in the next 2 months. So we'll see if there we go. Oh, clicker didn't work and then it went too far. Okay, so I'm going to talk just a little bit about history, our strategic plan, our resources, and then past work. So most of you know, right, that the founding legislative language for EQB really recognized the need to have a strategic interaction of the multiple agencies that connect to environmental issues in Minnesota. And so that's really part of the board's unique contribution to Minnesota's environmental governance, the ability to bring multiple agencies and the public together to advance interdisciplinary discussions on environmental issues. And EQB has been around since the early 70s, kind of in that flowering of the country's environmental law in the early 1970s. Originally established as the Environmental Quality Council by executive order, and then put into law in Chapter 116C along with the passage of the Environmental Policy Act in 1973. That really established the environmental review program. So key authorities that we have, our role in Minnesota Statute 116, the Minnesota Environmental Policy Act and 116D, kind of those two being our guiding stars. And then we also have various pieces of work in other statutes around critical areas, water policy, and water planning. Obviously, the major role that MEPA and 116C assigns to the EQB is the administration of the state's environmental review program and making rules in that program. But in its history, EQB has worked on a wide range of environmental issues or questions, ranging from animal agriculture to silica sand to how to incentivize solar on closed landfills. And the issues that we are asked to take on often reflect those larger complex issues of the day. So in 2024, we revised our strategic plan on our mission and vision. So our mission is to support informed decision-making that protects and enhances Minnesota's environmental quality. And we do this by fostering meaningful conversations, supporting collaborative policy and program development, and ensuring effective environmental review. Working towards, healthy and sustainable environmental quality and keeping in mind those values of collaboration, engagement, equity, and trust. When we reworked the strategic plan, we included sort of 4 major outcomes. And each outcome is supported by strategies that are going to help us make progress towards that outcome. And I will talk more about these in the second part of the presentation because we use these 4 strategic outcomes to really organize our work around the year. Obviously, we need budget and staff resources to be able to fulfill our outcomes and do our work. So our current budget is about $1.5 million per year, the vast majority of which, about 70%, is spent on staff. Sometimes we get project dollars, but mostly we get general fund. About 85% of our funding comes from the general fund. So this is fiscal 26-27, and of course, we'll be going to the legislature in 2027 with a request for the next fiscal year. Funding has been relatively stable over the past few years, going back, this is annual appropriations going back to fiscal year 20. You can see that our base is pretty stable with the addition of some project dollars in various times. So the biggest one recently was the money that the legislature allocated us for the completion of the greenhouse gas calculator. That's now substantially complete. So that funding supports myself and 8 full-time staff and 1 very part-time 9 staff member who's helping us with rulemaking. 5 of our staff are focused on supporting the environmental review program, providing technical assistance, updating guidance, working on the integration of climate. We also have the state pollinator coordinator, communication staff, and our board administrator. And so much of our effectiveness really comes from our ability to see and collaborate across connected activities of our member agencies. And you'll often hear us talk about the tech reps, and those are the agency technical experts that we work with, particularly on environmental review and similar issues, and they support their commissioners and provide a conduit and lines of communications between the staff and EQB and the agencies. And we may also have separate staff that we reach out to depending on projects. And MPCA provides administrative support, including HR and budgeting and all those operational things. So that's kind of the highlights of the setup and the basics of EQB. And then I want to just now give a little bit of an overview of the work we're doing and a review of some of the things that we accomplished in fiscal year 26. And a little bit of probably some previews of things that I think are coming next. So our first outcome is about engagement and fostering meaningful conversations. Public engagement is really fundamental to EQB. We make our best decisions when we have opportunities for the public to weigh in and when we hear and understand the broad interests of the state. And so the strategies and the work to support this outcome really focus on building and maintaining meaningful relationships with partners and stakeholders and bringing people together. So one of our key accomplishments in fiscal 26 was reinvigorating our youth engagement program by partnering with the Roots for the Future youth program. And I know those of you who saw their presentations last year, they came in August, were very impressed. The program's continuing to evolve, and we are continuing to engage with them in fiscal year 27. It's basically fiscal year 27. They're changing up that program a little bit. It's going to become a year-round program called the Roots Rising Action Council. And we are continuing to work with them and hope to find an opportunity for the students to address the board sometime in their next program year. So we're keeping that going. Over the past year, we also did a lot more talks, events, and trainings. We got requests to speak about data centers, about our climate calculator. Staff participated in multiple events where we were able to educate and engage Minnesotans around pollinators, and we added and increased our environmental review trainings. So a lot of this work is going to be ongoing moving forward, but I think we did a lot more outreach, and it was really fun. It's always fun to go out and Especially Rebecca gets to go to all the fun bug shows and talk to kids about bugs. It's always fun to join her, and I got to speak a lot too. So it was really nice to get out and interact with the community this year. We're also starting to think about the 2027 Environmental Congress. EQB has held environmental congresses at various intervals over its history to exchange information on progress and activities related to environmental improvement per the statute that authorizes them. Our last one was in the fall of 2024, and we're now looking to see what might make sense for 2027. We are considering and thinking about connecting with the recently released and updated Minnesota Climate Action Framework. The 2019 Environmental Congress, I think, had a big climate focus. So we're looking into that and working with the climate subcabinet and the agencies there, which has significant overlap with this board. And you will be hearing more about Environmental Congress as the year goes on. Another important role is facilitating interagency coordination. So state agency programs are aligned to support overall policy goals for public health and environmental protection. Major ongoing work in this space is coordinating work to protect pollinators through the Interagency Pollinator Protection Team, or the IPPT. This team, which is celebrating its 10-year anniversary this year, helps increases the agency's capacities by working together on pollinators. In the last couple of years, EQB staff have led that group in the development of a pollinator action framework and new updated scorecards so we can show Minnesotans how pollinators are doing. EQB is also responsible for helping Minnesotans understand, value, and actively support pollinators, which really helps drive a lot of that engagement work that I was just talking about. And again, really increase in fiscal 26, engaging and educating Minnesotans through events like the State Fair, the Minneapolis Monarch Festival, the Great Mindsect Show, partnerships with organizations like the Bell Museum, which is currently displaying our giant monarch flying sculpture, and Monarch joint venture. And then Rebecca has also worked with us to host peer-to-peer webinars and share best practices for supporting pollinators, including city-to-city webinars through Green Step. We also have statutorily assigned work around water planning, and in fiscal 26, was the year to prepare the groundwater policy report. We also work on the decennial state water plan that will happen in 2030. So that was one of our big accomplishments in fiscal 26 was to pull together the multiple agencies to complete that groundwater policy report. And we are engaging on climate issues. I participate in the climate subcabinet, and we're helping to move forward interagency work on climate issues. We're diving in right now primarily on the reporting and the metrics and targets that were set out in the climate action framework. As a public forum and a place with many agencies involved in climate work on the board, we could potentially be in a really good place to help shape how we tell the story to Minnesotans about all of the work we're all doing on climate. So that work is very much in development, and more to come on that as well. We helped create the metrics that went into the climate action framework, and sort of the long range work will be how do we continue to report on those. And also we were part of a cross-agency work group on sustainable aviation fuel. Next year, some work that's just starting to get going is there's a new long-range planning group at Minnesota Management and Budget, and they are interested in long-range water planning. Something kind of tentatively calling it Minnesota Water Vision 2100 or some combination of those words. But I am engaging and talking with them and hoping that may be something that will be beneficial as we work towards the 2030 state water plan. So I'm excited about that work, and again, just getting started. You will hear more. And then, of course, one of our key roles being oversight of Minnesota's environmental review program, including monitoring effectiveness and taking actions to improve it. That's really the key driver behind outcome 3 in our strategic plan, to maintain and improve the program. So you can see our key focuses here: guidance and training, particularly recently around climate information and the inclusion of climate in environmental review. improved data collection, and updates to environmental review rules. We made a lot of progress in fiscal 26. The climate calculator to help folks fill out that part of their environmental review was launched in fiscal 25, and we completed additional updates this year. We've done updates to important guidance, including how to submit public petitions, which, if you recall from our performance report in March, made a huge impact on the number of incomplete petitions that we received from members of the public. So that was great, time saver for everybody when those don't have to get redone. And just last week, we relaunched our AUAR guidance and updated web-based version, which is really important, I think, given the increasing use of that tool around the state. We also released data center FAQs, completed 2 legislatively mandated rulemakings, the first one on energy infrastructure, and then the rule to change EIS scoping for mandatory EISs that was directed by the legislature was adopted and published on June 8th. So that mandated rule is also complete. And of course, we made major project on the mandatory category rules for gas development projects, which went on public notice just before our May meeting and are open for comment through July 2nd. And we also completed the public engagement phase of our continuous improvement process. So a lot of accomplishments in the program. You'll hear more about those last 2 things in particular next month if you are on ARIS. I expect in general that a lot of the focus on guidance and training will continue in fiscal 27 and more additions like probably health, as we'll discuss in a moment, as we proceed, and of course, finishing up the gas resource development project rule. All right. Finally, we are working towards achieving environmental quality without disproportionate impacts. And one of our key goals here is to ensure that all EQB reports provide information on equity in implementing the state environmental goals. Equity was a key topic that we were able to integrate into multiple parts of the 2025 groundwater report, which I think was really well received, and I was pleased we were able to do. We do still have work to do exploring frameworks and tools that could support consideration of the potential for disproportionate impacts in environmental review. And I think some of our conversations and our work around health and environmental review may shape how we think about this moving forward. In addition, we've been tracking the work that MPCA is doing on cumulative impacts. They have a rule that also went on public notice on May 18th. And when they're done with that rule, we will be looking at that framework and considering how it might relate to environmental review and what we might need to do and then how that impacts our work, which of course, cumulative impacts and cumulative potential effects is a very big chunk of work. So we'll see where that goes. So that is like my overview of kind of the strategies and the outcomes put together with where we've been this past year, and I'm happy to take questions.
All right. Well, thank you, E.D. Nuschler, for that update and kind of a EQB 101. I actually really, even as somebody not new to EQB, appreciated the primer that this was, as well as these updates. So thank you for putting together this very helpful presentation. I will pause here and see if any of our board members have questions at this point. Not seeing or hearing any. I think we could probably move on to the next item in the agenda. And actually, that is the built-in break, although we've only been meeting for 30 minutes. So, but that said, I know our next item is kind of a bigger built out item. So I'll recommend we move on, but I am very open to board members suggesting we just take a break. So Catherine, you see anyone in the room who leaning one way or another?
I think I'm seeing a let's go through.
Just go.
Yeah.
All right. Okay, thanks for that, board members. So the next item that we have then is our the health and environmental review item. And we have presenting today. Let's see. I just accidentally closed my agenda. I'm sorry. Kayla, is that you who just sat up there at the table? Thanks. Okay. Sorry about that, Kayla. I was pretty sure it was you because it's environmental review, but I accidentally just closed my agenda. So I am going to go ahead and turn it over to Kayla Walsh, our environmental review coordinator.
Well, thank you, Chair, and thank you, board members. It's good to be here with you all in person. And thank you, members of the public. My name is Kayla Walsh. I work on our environmental review team here at EQB. A lot of my background is working at the state level on policy and program work. So before EQB, I was at the Pollution Control Agency. I did a lot on recycling and composting and waste prevention. So I am not an expert in health, but I'm excited to learn more about health alongside you all and our staff and hear all of our board members' perspectives on how health can show up more consistently in environmental review. Okay, thanks, Priscilla. Let's see if this works. Over the next year, we're hoping to focus on sort of researching, engaging the board's interest in different ways that we can potentially update the environmental review program in a way that elevates health as part of that conversation in environmental review. I really want to stress that today we're just introducing concepts. We're not choosing how to incorporate health. That's something that I think we'll be more prepared to do maybe next summer, more informed on it at that time. So we're going to give ourselves a long runway up to making any decisions. This meeting is a kickoff for what could be that year-long process to do more research, bring in experts, hear from you all as board members, and especially MDH, and sort of learn together and create this new shared understanding about what it means to think about health impacts and really how the board wants to think about shaping any program changes. So today we're laying the groundwork. No decisions today. Oh, okay. So we're going to start off with that quick history of the board's past work on health and then contextualize it with some of the ongoing things that are happening at EQB, other areas of the state, and then talk about our next steps with that timeline. And then we'll leave a lot of time for board discussion at the end. So we know that health concepts are already being discussed. They come up in environmental review documents, but we know that they also don't really show up in a very consistent way. Here at EQB, like Catherine was mentioning, we administer the rules for environmental review. When we talk about environmental review, we really emphasize that it's an information gathering process that helps to inform decision makers before a permit, and it involves a public process. And when we think about impacts to human health in environmental review, what comes to my mind, at least immediately, are things that impact physical health, like air pollution, impaired water, noise impacts. Those things seem pretty quantitative, have a direct impact, they're more measurable. And the current environmental assessment worksheet form even asks for how a project might affect air quality, and it says including any sensitive receptors, human health, or applicable regulatory criteria. So I think sometimes human health impacts do feel like a more intuitive fit in that form or in ER, environmental review. But there are a lot of different factors that you can see here on the screen that also influence health, the health of an individual or the health of a community. And those factors or determinants of health include things in our social and economic environment, as well as our physical environment. So those examples of social determinants of health are green spaces, maybe safe housing, healthy food, or public transit. So health can be interpreted in a lot of different ways to include public health and health equity in the built environment. And we don't have one single definition that we're using in environmental review rules right now or statute that really scopes it specifically for environmental review. So the EAW doesn't specifically ask for any of these social determinants of health, and EQB has heard that this can lead to some inconsistencies in how health shows up. So that's why a lot of the previous work that we've researched and found on this topic points out that it might provide some consistency if we had more clear expectations on how to scope health and how to include health consistently in environmental review. So our governing statute that Catherine mentioned is the Minnesota Environmental Policy Act, or MEPA, and that does give us some leeway to think about health in ER. If you read through it, it outlines some of the clear goals that point both to the health of the environment and the health of the people in Minnesota. So MEPA is really our foundational legislation. It's a statute that directs EQB to do our rulemaking for the program. And it's important, I think, to note that health concepts do play a role in this legislation. And it was on the minds of sort of the architects of our program back in 1973. So specifically, MEPA's purpose is to encourage harmony between human beings and their environment and promote the health and welfare of human beings. It also goes on to assign state responsibilities to assure for all people safe, healthful, and productive surroundings. Very cool, idealistic statute that we're built on. So why focus on health? Right now, we feel like MEPA sets a good stage for considering health, and the board has directed staff to consider health in our work planning in the past. So we feel like it's an important topic for environmental review. At the same time, we know there are also a lot of open questions that seem to continue coming up over time. Because the environmental review rules don't explicitly use the word health. So we do see a lot of discussion around the potential human health impacts in those documents, and we know it can be difficult for responsible governmental units doing reviews to know when or how to include health. We're sort of wading back into this topic for those reasons, and also it's come up in more of our recent work in our public engagement. And we also have the bandwidth to do, I think, a little bit more on health right now, because originally in our FY 2020 work plan, the board selected for staff to work on incorporating climate change and then health into environmental review. We feel like we're in a good spot with health right now with publishing the updated EAW form and the climate tool, calculator tool. And so we also heard more about health in our environmental review continuous improvement program. And in 2023, through that process, we heard that one idea was to incorporate and elevate health in environmental review. And we scored that pretty high in our continuous improvement process, because if we did that successfully, we feel like we could increase usable information that's coming to us in those reviews. It would encourage more public engagement, and it would also provide some clarity for the process. And those three criteria for an effective program also align with the three of our main objectives for environmental review, which is to provide usable information, provide the public with access to decision makers, and then reduce delay and uncertainty in the process. So we feel like there's a sort of a confluence of factors that makes now a good time for us to re-enter this conversation. We know that so MEPA really paved the way for health, and then we have a lot of health showing up in environmental reviews, but more consistently conversations have happened since about 2010 that are focusing on how do we make sure that health shows up in environmental review consistently. So in 2010, the Minnesota Department of Health, MDH, received some funds from the Center for Disease Control and Prevention to consider health impacts in their planning and their policy decision, or in more planning policy decisions. So part of that grant is why MDH is exploring whether climate change and health effects were being considered in our EAW form. And in 2012, MDH published the results of that report. I think it was a really thorough report, and that's why we cited a lot in our memo. It included a literature review and a lot of research on how health frameworks were being talked about nationally, internationally at the time, And then also they focused on 5 other states that were addressing public health through their environmental review programs. It also reviewed current at that time EAWs for how health was already showing up in those documents, and it made recommendations to the board. So I think the report pretty clearly articulated how the built environment impacts the health of the public and how the EAW is useful, is used to assess many different types of projects that alter our natural and our built environment. And it started thinking about how does that factor into our health? And I think they did a really great job documenting how that form is already highlighting health-based information and then suggesting ways that it could easily do that more frequently throughout the form and the process. So for example, the report says an analysis of air quality impacts was the most comprehensive way that health was showing up in environmental review, probably because it was being asked for specifically. But that the EAWs were also tying health impacts into potential impacts like hazardous waste exposures, groundwater contamination, soil contamination, and noise. And they made recommendations for other areas in the form that we could also talk about health. The report said pretty clearly that the definition of health is really important in the context of environmental review. So it would be helpful to agree on that scope of health at the start. The report also said among reviewed studies, there is general consensus that the definition of health should be broad and include socioeconomic status, mental health, and other health determinants. I think it's important to kind of point out that health definitions they're very variable. They can be very narrow to very holistic, like the World Health Organization says, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. The MDH report also recommended, as I said, different ways that we can encourage health impacts are considered when we're gathering that useful information for reviews and prompting for more health-based information on the form. Again, these are just examples of some of the recommendations that came out of the report at that time. And I think it'd be interesting to see if we updated our research, if we came to some of those similar ideas today. The report also talked a lot about health impacts assessments and how health impacts assessments could be or could relate to environmental review. And so we'll dive into that a little bit more. After MDH published this report, it seems like there was also a period of time where they had a little bit of focus on HIAs or health impacts assessments. And then EQB started hearing more and more public interest in using HIAs in environmental review. And HIA is really one format or one way of predicting how a project, a policy, or a program can affect people's health. So HIAs are often used in, I think, shorthand for talking about health in environmental review, but they're really just one framework out of many that we can look to for an example. But since we've had some past conversations, or the board has had some past conversations and even requests for doing HIAs, I think that it would be helpful to do sort of a quick explainer on what they are. And I think this could also become a more in-depth topic if the board wanted to come back to this at a future meeting. But pretty high level, I think the definition from MDH does a great job. HIAs are a process used by organizations and communities to provide decision makers with information about a policy, program, or project that could affect the health of people. And it emphasizes more of that comprehensive approach to include economic, political, social, psychological, and environmental factors. So right away, we see a lot of parallels with environmental review in that we're getting usable information through an HIA. We're doing that to help decision makers. It's including community engagement and helping us understand, which communities are potentially affected and which social determinants of health might be more impactful to that community. And so again, those social determinants of health are the factors that are going to shape behavior and ability to live healthy lives. HIAs have a clear screening and process steps, and that includes scoping and assessing and recommending changes to decision makers. So HIAs can be really detailed or really in-depth. I think the first thing that comes to mind for most people is probably the comprehensive HIA. And that's really extensive. It has a lot of engagement, involves a lot of communities and interested parties and new data. But there's also a rapid appraisal that's a little bit more straightforward. There's no new field survey work. It focuses on peer-reviewed research. And then there's also a desktop HIA. So that, from what I've seen, is really more useful in determining whether a more detailed review might be needed later on. But no matter the level of analysis, I think the main purpose of an HIA is really to help identify and to quantify health impacts, and to see whether they're benefiting or burdening people disproportionately. So again, after MDH published the 2012 study, they formed a coalition that was active from 2013 to 2017. And that HIA coalition published an action guide. And then since 2009, they performed over 30 HIAs. And those were on things like residential development plans and transportation plans. And so we linked to one of those in case you're interested in looking more at an example later on. But in May of 2016, the Minnesota Association of Family Physicians unanimously passed a resolution that was supporting a petition for HIA rulemaking. And that rulemaking was to require an HIA for any sulfide mining projects that did environmental review. So that petition for rulemaking was sent to the board in 2016, discussed at the October 2016 board meeting, and the board heard presentations and public comment on HIAs. And then this spurred really a lot of conversation about the broader questions around health and environmental review. At the time, EQB was also starting a rulemaking for mandatory categories updates. So we received some comments related to, again, these bigger picture questions like climate and health. So to help answer these, or at least start working toward these, the board formed an environmental review advisory panel, which we call ERAP. And the goal of ERAP was to modernize the environmental review program. And that panel was really tasked with discussing a lot of different topics, but two of those topics were health and climate change. So panelists met in August 2017 and February 2018, and they heard presentations from MDH, from the Minnesota Association of Family Physicians, who had sent in that petition. And they agreed on this problem statement, saying that there is not a consistent approach for addressing all aspects of health in the environmental review process. So ERAP discussed some large questions that I think remain sort of open-ended to us today still. To what extent are human health impacts showing up in our documents now? How should health show up, and how should we scope that definition of health to make sure the right info is included? What values does HIA have for environmental review? And then what do we not know? What are our knowledge gaps, and how do we educate ourselves to fill those knowledge gaps before moving forward? The final report, ultimately from ERAP, did not agree on a recommendation. So there were about 15 members, including RGUs, contractors, industry representatives, and members of the public experts, and they discussed really how to define environmental review, but they did not agree on that. They did not agree on how HIAs should be used in environmental review, and what they did agree on was that EQB, no matter what we do, we should prioritize some trainings and education and guidance before starting any new process. And they also agreed that we should continue these conversations and also take a closer look at sort of, are there certain project types in environmental review that might have the greatest impact for health, or are there certain social determinants of health per each project type? So after the ERAP final report was then presented to the board, they decided to approve a staff work plan that focused on integrating both the topics of climate and health consistently, as I said before. But they directed staff to focus on climate first, which is why we started working on updating the EEW form. And so since we've now largely completed that, we have that more capacity now to start considering health as our next initiative. In our 2023 and our 2026 continuous improvement process, again, we heard public feedback. So we've seen sort of a renewed interest in this topic, and that led to some discussions at board meetings recently where we heard board members were interested in the topic of health. Again, we're seeing sustained interest from folks like the Minnesota Association of Family Physicians, and the Minnesota Indian Affairs Council actually passed a resolution in November of 2024 supporting a requirement that a comprehensive and independent HIA be prepared for any project in Minnesota that requires an EIS. And they called upon the legislature, governor, and EQB and state agencies to adopt a policy and provide support for its implementation. Days later, after MIAC passed this resolution, we at EQB published our 2024 mandatory category report. And that report also addressed some of our public engagement there surrounding mandatory categories for EEWs and EISs, where we heard that folks were also asking us to address environmental justice principles and health principles in environmental review. So there was sort of this confluence of renewed interest in the topic. And as Catherine was mentioning earlier, we do have sort of ongoing statewide work related to cumulative impacts, and we now have a statutory definition for environmental justice areas. And so there are some of these related topics to health that we're keeping an eye on and could be for future conversations at our board level. So given all of that recent history and how we're sort of evolving our understanding of public health in recent years, that's why we're really focusing on this now. And our EQB work plan item for this year was to sort of summarize our history of health in EQB. And then moving forward, we have sort of some open-ended questions, as I mentioned earlier, that staff are still thinking about when we're thinking about researching health and environmental review. So how is it currently showing up? How do we define it? How do we use it in decision-making? And what determinants of health are either quantitatively or qualitatively known for most project types or for specific projects? So what are our next steps in our timeline? How do we move forward with this? Staff want to begin with research. We have some hopes to do sort of a literature review that is similar to that 2012 MDH study and just look at how have frameworks evolved? What are they? What are we really looking at? What are our options for other frameworks that we can look to? And then we want to also review how many of our environmental assessment worksheets in the past year or so are already incorporating health. Are there some common ways that we're already seeing this happen throughout our work? And then we want to outline sort of potential ways to scope health in terms of how it's included in environmental review. And eventually we would bring that or any project ideas to ARIS. And then ARIS would bring that to the board. But how does that fit with long-term process? So today is just an intro, and then in August, we're hoping for the board to approve a work plan that has health. But that work plan item would hopefully just be that staff would research options to move forward. And we would continue doing that research over the course of the next year and look at the sort of forming options based on board feedback in terms of what we want sort of that implementation of health in environmental review to look like. And then by August of 2027, if we're thinking about this timeline, then the board would approve sort of a more tangible, implementable work plan item on our environmental review staff's work plan. And then from August 2027 moving forward into the next fiscal year, that's when we would be working together to implement whatever we choose to be our strategy to elevate health in environmental review. I know that's a lot of very high level information, and I think there's a lot of different directions that we can take this research and a lot of different ways that we can incorporate health frameworks in environmental review. And so we're really curious to hear sort of your perspectives, just your reactions to that. And if you have any ideas for how we can incorporate other information in our research that we're doing in the next couple weeks or next couple months. And then what future board topics, what experts should we pull in to come and speak to the board about different topics? What would you be interested in hearing? And then what other general considerations we keep in mind as we kind of move this forward? So these are just examples for discussion, and I think I'm ready to turn it back over to you, Chair, for the discussion portion.
Great. Well, thank you, Kayla. And yeah, I think it's helpful to have this slide up. First of all, thanks for grounding us in the board's past work on this topic of health and how we might move forward here in the future. Appreciated that timeline too. So today was the intro to health. And I thought your presentation was very helpful. So board members, so here we go. This is discussion time now. What questions do you have about any of the past work that Kayla talked about or that you've heard about in this area? And as the staff are working to put together an item for next year's work plan on this topic, what input do you have? So please give that a moment to think about if you don't have it at the ready right at the moment, but be ready to raise your hand and jump in because this is going to be a pretty informal discussion at this point. So I will just see if anyone's raising their hand or Executive Director Nuschler, if you see anyone in the room raising their hand, please let me know.
Assistant Commissioner Kunis has raised her hand. Thank you. Kayla, thank you so much for this presentation. I think it was, you could work at MDH. Kidding, but not kidding. But seriously, it was a great presentation. Really appreciate that. We're really supportive of the board's taking on this conversation and this discussion. I know that there's been support and glad the timing is happening. I think it would be really important to really take a deep dive in the HIAs. It is one tool. You spelled that out. I cannot reinforce that enough. It is one tool that could be used. It does not mean that it is necessarily the right tool for this purpose. So I just want to emphasize that. And I think it'll be really valuable for this board to learn a lot more about HIAs. We have some expertise that we can certainly share and bring forward to the board in the coming months. So, but really appreciate this. Public health is in everything, and it definitely has an impact here too. So appreciate the bringing this forward.
Thank you, Myra. All right. Any other thoughts there in the room?
I see Board Member Smith and then Commissioner Stroman.
Okay, we'll go to Board Member Smith next. Go ahead.
Thank you, Chair. Appreciate that. And Kayla, again, thank you. Just to ditto what already stated, but I think as we're looking at this information moving forward, research topics, I know that 2012 report exists. Obviously, it's a starting point, but it's been a long time since that was published. So what else? What are other states doing currently, or are there other ways that this information is incorporated into projects within Minnesota Time Now? And I think our Department of Health colleagues and experts can probably help answer some of those questions of just how is this information used now? And what is the benefit to make sure that that is front and center? As far as future presentation topics, yeah, HIA is one piece. I don't know the ins and outs of an HIA, so I think more understanding around what that entails. And I just pulled up the PDF document that, I can do my homework and dig in, but maybe a presentation on that. And then what other tools exist? What else is out there that would have similar results, impact, et cetera. And I think for general considerations, since I do environmental review on the civilians on the regular side, my day job, it's important to be able to really understand what publicly available resources are present. Because when you start looking at the climate calculator, that is fantastic, and now we have that tool available, you know, you don't have to start figuring out, all right, how do we do this? So I think when RGUs are asking these questions of, all right, what do we have? What's the information available now? What tools, resources are available now? Or do I have to now have another consultant do another study that is then summarized and brought in? So that happens all the time, and we start getting bigger and broader and deeper and et cetera with the environmental review process, which is very important. And we need to be cognizant of smaller RGUs don't always have the budgets to be able to do this. So that's just something I want to make sure that the guidance, when we get it to ARIS and bring it back to the board, is very clear, it's concise, it's easily defined, and it's easy to follow. So that'll be some of my conversation pieces for now, but appreciate and looking forward to learning more. Thank you.
Thank you, Board Member Smith. And then yeah, on the couple items there that you mentioned too, I'll just note that I heard a interest in some more information or presentations on what has been done in the way of health impact assessments. And Kayla had noted in transportation, we had looked at that as part of our statewide multimodal transportation system plan. I think we could, certainly I could connect Kayla or others at EQB with folks from MnDOT who worked in that space a little bit too, and we could bring that to a future presentation if that's of interest as well. But I will go on to, I think, let's see, I see a hand up, but Catherine, did you also mention that Commissioner Stroman, was it in the room, who also had her hand up?
Yes.
Okay, we'll go to Commissioner Stroman, and then we will go to, I think that is Board Member Larson, who has her hand up. So go ahead, Commissioner Stroman.
Thank you, Chair Daubenberger. I was actually going to go very much along the same lines that Board Member Smith just went. I think Commissioner Granville was on the same page too. None of us are interested in reinventing a wheel that has been already invented and road tested in another state. And so I think updating this kind of state scan that was done in 2012. And I mean, in particular, in this, I would advocate for this being a presentation if we can get someone to share their time with us. But I think both from, you know, the state's perspective, and that may be the same as the RGU, or it may not be, and then a project proposer's perspective as well. I think seeing it sort of full circle would be really helpful to understand sort of the theoretical, right, that we might be seeing in some of this, and also we might be hearing from folks, and then also like the real practical, what pitfalls have people experienced, where have things worked really well, how has it worked, you know, for project proposers in addition to government units. So I think that would be a really interesting conversation, because I'm determined we could learn a lot, and then obviously adapt it for our way that we work in Minnesota and our particular issues. But I think updating that scan and having some dialogue would be really good. Thank you.
Thank you, Commissioner Stroman. All right, why don't we go then next to Board Member Larson.
Thank you, Chair. Hi, everybody. So first meeting, and I'm happy to take some of this offline, but I was curious, Kayla, that was a really good presentation, and maybe you're the one to answer this question, or again, maybe it's something that I missed in the packet somewhere, but I do think a definition of some of those key terms and some agreement on what some of those words mean as we're actually embedding that value in policy moving forward will be important. And I flag that in part from the local government level, having implemented the value of health into our recent comprehensive plan. We had to spend more time than I expected on making sure that we understood and shared a definition, not completely, but that became the foundation of which we could build policy and understanding and relationship around some of those areas. And so you had mentioned that there was a thing in a slide that mentioned the definition of some of those terms. And I don't remember if those terms have already been defined or if that's part of the research that will be going in the first year. And so that is my question. Have things been defined and or is that part of what's up in the first year?
Thank you for that question. Kayla, do you have thoughts on that?
Yeah, I think it is really important whether we end up putting a definition in rule or not to make sure that we all have that shared understanding of what it means when we're talking about health or even social determinants of health, what's included in that or not. And so I think that's a really poignant remark that we should definitely spend that time in grounding ourselves and making sure we're all agreeing on that. So I don't know if you wanted to add.
And I think Chair Daubenberg, if I can jump in, as we've started to think about like what we might undertake in the research, the updating that state scan is high on the list. And I think, we talk about, we want to look at the environmental reviews and documents over the past years and sort of say, do they include health? Well, then we need a definition, right? Or what I've sort of in my head called like an organizing concept. And so I sort of am formulating this idea of like, there's multiple definition there's definitions from sort of narrow to broad that we could lay out as a start and say, okay, 8 documents did things that fall into this bucket and 2 documents did things that fall into this bucket. And so that's sort of what I'm thinking about is if we can set up kind of a couple of concepts of different definitions of health and then see where things fall and then continue to scope those. Because I think Board Member Larson, they are somewhat defined, but like, do we all agree on which one is helpful for the kinds of projects that this program looks at? So I think that would be, thinking that will be part of what we want to do in the next year is to kind of set that out, use it to review some of the documents. Kayla mentioned environmental review documents, but I know it comes up a lot in the comments that folks receive on the environmental review. So I think that might be something that we might look at. I know several of the agencies are dealing with some of those at the moment, and kind of, see where they fit in the possible sort of scopes, if that's helpful. Okay.
Great, thank you. And then I don't see your hand anymore, but Chair Holman, go ahead. And by the way, before you do, Chair Holman, when you're not talking, if you could be on mute, I feel like I'm getting some feedback from your background potentially, but I will go ahead and let you have your question here. Thanks.
Yes, Madam Chair, I apologize for that background. I've been getting mixed messages on the mute on or off, and so I've been trying to turn it on when I'm ready to speak and turn it off, but I've obviously been bobbling that, so I apologize for that, and I'll try to be vigilant. One of the things I wanted to build on is Kayla's presentation, which was excellent, presented the broad and diverse health impacts kind of scope, and I think it's very difficult for local or RGUs to kind of wrangle with the expertise, and Board Member Smith touched on this, that the RGU scope of knowledge on all of those is really dependent. And I will share, as a former RGU person administering environmental review, that you really rely on agencies to communicate back on health related impacts in this particular case. And so as we develop this language, keeping an eye on what would DOT comment on and what substantive conditions would they comment on? What would DNR comment on a health impact assessment, and what pragmatic conditions that can be implemented at the local level? Because the local RGU is completely dependent on those professional recommendations to incorporate into their local mitigative environmental review process. If there are conditions, if there are things that can mitigate the impacts that have been called out in the process. So as we move forward, I think my voice is to think about the practitioners and how that comes from the agencies to the RGU, and to make sure that it's not nebulous, fuzzy, hard to understand, and that there can be, in fact, health-related impact statements that can be turned into conditions, can be turned into substantive controls that benefit the community impacted. Thank you.
Madam Chair, we have Board Member Martin here in the room.
Thanks, Chair Dumberger. I'm much more familiar just because of the work I've done in my career with the climate thing. So that wasn't so intimidating to me, and I know much less about health. But it felt to me like at the start of that climate conversation, there was a lot of anxiety that like we were adding something that was going to be very difficult, and we managed, I think, to make it by providing resources like the greenhouse gas footprinting calculator and links to state resources on climate forecasts and adaptation stuff. I think we managed to make that feel much more doable. I mean, I don't know how RGUs feel about it and how proposers feel about it, but the state was able to do a lot that provided people tools that were like, you can use this and there's defaults in it, but like if you know more about your project, you can put in more specific things. So I'm just wondering, do you see, being not very familiar with this, I just wonder if there's anything analogous that you see potential for here. It's not just, I mean, yeah, definitions are important, case studies would be useful or whatever, but are there tools that could be developed to make this less of an unknown to the folks who are going to be having to, or could be having to use it as well?
Thank you, Board Member Martin. I appreciate that analogy. And yeah, I'll let either Director Nussler or Kayla provide any thoughts on that parallel.
I think I would probably ask Board Member Martin to ask the Assistant Commissioner sitting next to him. I think it's a really good point. It's certainly something that we'll be thinking about, but I think Assistant Commissioner Kunis would have a better idea of what's out there than I do.
I can't answer what's out there right now, but I think that's something that we can look into over the next year. And not just I think it's critical to this conversation to make sure that it's going to be user friendly as much as possible, right? And not burden folks that are completing.
And I would maybe just add as a reminder, right? We have multiple tools at our disposal for making changes, right? So we don't necessarily have to go down the same path that we did with climate change, where it ends up in the form and we do a test. It might be, recommendations. It might be, I mean, we can change guidance. We can change the form. We can go all the way to asking for, or to doing a rule change or asking legislature to change it. I mean, we have this broad range of options, and I don't think we have thought at all about what we want to do will impact what tool we use. So, and I think, Madam Chair, I saw Board Member Dingman's hand come up here in the room.
Great. Go ahead, Board Member Dingman.
So that was one of my initial ideas, was like, we don't want to reinvent the wheel. But I also, one of the things when I was going through some of the materials, and you just mentioned it, Catherine, about this idea of legislation and potentially funding. It makes me also think, and maybe this is a bad time to mention this, but AI is everywhere, potentially talking about tools to alleviate some of the burdens of maybe just general questions people have, or just implementation. Potentially, are other states using AI in incorporation of, because like we're all talking about what is the definition of health. Maybe there's a way to use what other states are already incorporating, something like AI or some kind of AI tool.
All right, thank you, Board Member Dingman, for that suggestion to take a look at other states' tools on this. Great. Others who want to jump in here? Anyone else there in the room, Catherine?
Do not see any other hands here in the room, Madam Chair.
All right. Well, maybe I'll jump in then with a question or suggestion too. Kayla, to your question about information staff should include in the initial research phase, just last month, I believe, early May, other board members and I received a copy of a report called Environmental Risk Factors and Iowa's Cancer Crisis. And that was from a board member of the Minnesota Well Owners Organization. And seems like that might be a useful report to review and thinking about health effects. That certainly was something that piqued my interest. But as we're considering health and environmental review, that might be an item to just take a look at. All right. I'll do a last call for any other thoughts from board members on this item. Just kind of scratching the surface here today. There's be a lot of work ahead, of course. Right. I don't think I'm seeing anything. Catherine, any last thoughts there in the room?
No, I don't see any hands, Madam Chair. So I think the plan is to bring the environmental review whole program work plan to Eris for some review and input next month. So we'll have kind of a little bit of more of a scoped idea, probably generally following the direction that you all pointed to today for the Eris folks next month.
Great. Well, thank you for that. All right. Thanks again, Kayla, for the information you provided us. And thank you, board members, for the robust discussion that we had on this today. So then that'll move us on to the public comment period, or final agenda item. So this is a chance for you members of the public out there to provide input to the board about issues related to the board's purview or authority. If you have a question for the board members, or you could be staff, I will ask staff to note that and get back to you at a later time. If any other board members are interested in hearing about or being involved in the follow-up, please let me know on that. But this ensures we have enough time at a meeting for all commenters to provide input at the board meeting, and that your questions can be fully considered before trying to answer them on the spot. So let's go ahead and move into that comment period. And to make a comment, please make sure you've either signed up on the in-person sheet, if there are any folks there in the room, or raise your hand in Teams. And we will, if you are in person, we'll call your name from the sign-up sheet and ask you to join up there at the table to speak. But if you're online, we'll notify you when you can unmute and speak. So just for those who are online and waiting to speak, please be patient, as there might be a little lag before you can click and get unmuted to speak. So Sarah will call on you. And as always, please keep your remarks fairly concise. And with that, Sarah, can you call on the first commenter?
Mr. Daubenberger, there are no commenters present in the room.
Thank you.
And at this time, I do not see any online commenters either.
All right. Okay, I'll just pause for another moment in case public members or those from the public are looking to raise their hand and just not there yet. All right, I'm not seeing anything for hands raised. So with that, why don't we go ahead to the closing of the meeting and adjournment. So again, thank you, board members, for your participation today. Thank you all for those who were able to come and join the meeting in person. Again, I regret I could not be there with you today, but appreciate everybody's participation and thoughtful discussion. And we have reached the end of the agenda. So this would be the last call for any further business. Not seeing or hearing anything? All right,
No
then I
hands,
think,
no hands raised
nope.
in the room.
Got it. Great. Thank you, Catherine, for verifying that. All right, then the meeting is adjourned. Thanks again, everyone. Have a good rest of the week and hope to see you soon.